A local doctor on the front lines of fighting the COVID-19 pandemic believes many people are getting bad information about when to get tested for the virus if you've been exposed to someone who has it. KXAN investigator Aaron Cargile has our top story.
This is a very tricky infection to deal with.
Dr. Stephen Pierce reached out to KXAN over the Labor Day weekend, eager to get the word out about something he's told many patients showing up for a COVID-19 test.
Your test is too soon after your exposure to be sure that it's a valid negative result.
He works at the Texas MedClinic at Mopac and Parmer Lane.
It's frustrating for us as physicians to see these people who were exposed 2 and 3 days ago. They get a test and they're negative, and you have to tell them you're negative, but you still might be infected.
That's because the virus's incubation period is around 5 to 7 days, but can be up to 2 weeks. Even the Centers for Disease Control says early testing after exposure at a single time point may miss many infections. So, how long should you wait? If you're not experiencing symptoms,
the best test is 8 days or more after exposure. Then you have an 80% reliability that it's going to be a correct result.
Dr. Pierce says also they're just as busy as ever here at his clinic seeing COVID-19 patients. And recently, he's seeing a lot more young people, specifically students from the University of Texas.
Occasionally, they were out in a crowd of people, but for the most part, typically roommates, and they have one or more roommates who are positive for coronavirus, and not adequately in the roommate situation, not adequately distancing or quarantining from the roommate.
UT has not updated new case numbers since Friday after coming off its highest week of student cases yet, 113. It could be a week or more before we see how well Central Texans did slowing the spread of the virus over the Labor Day weekend. Aaron Cargile, KXAN, investigates.
Dr. Pierce says it's important that after you are exposed to someone with COVID-19, you immediately quarantine for 14 days while waiting until that 8th day to get tested. He said Texas MedClinic has also been seeing quite a few strep throat cases now and a few cases of the flu. The flu is opposite of the coronavirus. You need to get tested within 48 hours once symptoms begin. Here's a look now at the status of COVID-19 testing by Austin Public Health. Currently, anyone who wants to be tested can get one. You do not need to be showing symptoms. APH says it has the capacity to test 1,000 people per day, and you can expect to get your results back in about 2 days. The health agency did see a drop in demand for testing last month.